And this upcoming topic will be one that's a bit hard to hear, but experts are concerned over a spike in eating disorders among adolescents and teens in Canada. During the pandemic, Alberta's children's hospitals say their admissions have doubled. In Winnipeg, treatment has tripled, and in Newfoundland and Labrador, the wait time for treatment is estimated to be a year or longer. Joining us now for more on this is Professor of Pediatrics at SickKids Hospital, Dr. Debra Katzman. Doctor, thank you so much for joining us and taking the time. And why don't we start there with the concern that we're seeing across the country? How has the pandemic made this such a critical situation that we should be talking about?
Well, thanks so much, Donovan, for having me this morning. The pandemic has had a significant impact on youth eating disorders and mental health in general. Early on in the pandemic, I would say from about March through July, we were seeing about the same number of young people who were coming to our outpatient program, admitted to our inpatient program and our emergency room. But then starting in about August last year, and especially through November and December, we saw this unprecedented surge in the number of young people with eating disorders who were not only being referred to our program, but were also presenting to the emergency room. And at SickKids, our numbers have increased about 50%. And as a result of this, we had to open a second unit and resource that unit to treat young people. And I would say that that probably is an underestimation, because we've been fortunate enough to have our community providers take up some of these young people into community hospitals. What we're seeing is young people who are much sicker than previously. They present with much lower weights, they're severely malnourished, and they often have co-occurring mental illnesses like depression and anxiety, which makes a very, very complex presentation. You know, many people ask, well, why do we have this surge? And I would say that there's no one particular cause. Probably it's the result of a number of colliding factors, Donovan. The school closures, young people and lack of routine, young people being disconnected from their peers and being socially isolated. Lots of young people had a reduction in their extracurricular activities. And kids normally sort of congregate in places where there are trusted adults like teachers and coaches who can easily pick up on these warning signs. Young people have lots of increased time on social media and lots of exposures to fat-phobic messages and diet talk. There's been a loss of significant events that have occurred, such as proms and graduations, and there's been lots of strain on families. So these are some of the reasons why this surge, we believe, has occurred. And it's not only occurred, as you mentioned, Donovan, at SickKids, but my colleagues across the country in a number of tertiary care child and adolescent eating disorder programs have seen this unprecedented increase.
Well, that's great context. And before we let you go, people watching, what signs should we look for in teens or adolescents to make sure that we can provide support?
So there are lots of signs that young people can show. There's their physical appearance. Lots of kids will have weight loss. They'll wear baggy clothes because they want to keep warm, or else they want to hide their weight loss. Changes in eating behaviors, skipping meals, eating alone, weighing food, reading the food labels, exercising a lot. They may use medications to impact their weight. And of course, there are other behaviors like social isolation, poor concentration, low mood, resistance to change, frequent weighing. And I would say that if parents are worried about their young people, I would encourage them to talk to their child about their concerns. It's reasonable to express your concerns and request that your child be evaluated by their family physician or pediatrician. Like any other cold or cough, if you're concerned about your young person, you tell your child that you were concerned about their cold or cough, and you'd have them go and see their physician.
Well, I'm glad we got that context from you, and glad that there are some resources that people can use. AboutKidsHealth.ca is one. Thank you, doctor, so much for your time.
Thanks, Donovan.